COVID-19 inoculations could be an annual thing. This as more and more mutations are slightly evasive to the vaccine, and the immune system of the vaxxed weakens against new COVID strains over time. Countries like the US, UK and Israel have started administering booster jabs, prioritizing the most vulnerable and healthcare workers.
Those antibody levels do not stay at high titer endlessly. They wane over time. So, even in the context of large vaccine rollout, people are going to have to get boosters if we want to keep the number of variants to a minimum.
Over 16,000 COVID-19 genomes have been discovered since the pandemic began. Deputy Minister hinted at the administration of the booster vaccine by next year.
We will try not to confuse our South Africans. Right now, we're trying to push as many of us to be vaccinated, at least until the end of December. We're chasing this 40 million South Africans adult population to be vaccinated. We are probably more referring to what we call a booster. A booster is usually given after vaccination, maybe a year or 2 years, to people who have already vaccinated. That will also come in maybe July next year. So that is not really our agenda item currently. It's something down the line that we are looking into.
The NICD says it is still studying how evasive the recent discovered C.1.2 variant is to the COVID-19 vaccine.
We're still getting some data in terms of its sensitivity to antibodies, so I can't comment on that one. But in terms of the others, the reason why they are, like the Mu, for example, the Lambda, the reason why they are now in the headlines and they're concerning is because they do have reduced sensitivity to antibody responses.
Dr. Beenham could not confirm or deny whether recent hospitalizations of vaccinated patients at the Groote Hospital in Cape Town is due to their immune system waning over time against COVID, or whether there could be some underlying comorbidities. Ofentse, Setimo, SABC News, Pretoria.